Oh, now welcome back. So today we want shook mat into some small healthcare matter before we enter our original gist. And we get a guest who will follow us talk today. His name na Femi Oyewole Tokwe. And in a clinical person, we don't enter inside Nigerian healthcare entrepreneurship in the build data and tech-driven healthcare ecosystem. And we want to talk about how we go include hospitals and retail pharmacies for this matter, so that healthcare will be accessible to many Nigerians who go fit, afford them, take help themselves. Welcome to the show, Tolulope. You there?
Yes, I'm there. Thank you very much.
Welcome.
Good morning.
Welcome. Yes, so healthcare is an issue where affects all of us one way or the other. And many times, the way our healthcare be, I know so many people, they try their best to see how they go make sure, say, in they accessible to even people where they inside rural areas. What do you think, say, we supposed do as a people, to make sure, say, everybody feel waka meets, any healthcare professional when they get any issue. Anybody feel waka meet, whether na mobile hospital or whether na, regular hospital or primary healthcare centers, or say things just near people where it go dey easy for them to take access.
Thank you very much. I don't know, maybe make I talk out for pitch, for English.
Anyhow, if you yanam, we go hear you.
Okay. Yeah, I'll just try to mix the two of them. So my name is Femi. I'm a medical doctor. I'm leading the team at Fortis Life Group. So basically, the question you asked is what we're actually trying to do, which is to try to make equitable access. And for us, our own they say is more about not just say everybody get access to healthcare. We want to make sure say the access you get for Zamfara is the same access you get for Lagos. Do you understand? So basically the same quality of care that you're getting anywhere in Nigeria, right? And that's something that we always miss out. When we talk about accessibility, we always forget, say access really is sometimes, but are they accessing the same thing? Do you understand what I mean? Right? And so I think that one of the things in healthcare is the fact that we don't have the critical infrastructure to provide accessibility. So facilities not really day like that. And that boils down to the fact that we have not gotten a lot of investment into the space, right? But that is okay. What should now happen is the fact that we need to now plan with the limited resources that we have. So the small way we get, we need to plan with them well. Okay. And how do you plan when you don't have insights, right? And so for us basically, one of the things to create a critical infrastructure when you don't talk already, create multiple clinics, create retail pharmacies, because at the end of the day, those are your data collection points, as it were. Apart from giving care, they're data collection points, right? Also, you are using that data to make proper decision making, policy planning, most importantly, resource allocation. Like I said, investment no money for the ecosystem. So we are just working with the little that we have. Even the government is just 5% of the budget. So the little that you have, you can't afford to waste it. I always say that financial negligence in medicine is almost the same as medical negligence, because at the end of the day, medicine is being driven by finances, right? So if we don't get the right data, and data is not just for insight, it's for planning. Is for, especially we also in Nigeria, resource allocation. And that's what we really try to do. And I think that that's the way to help us get, obviously we would like more investment in the sector, but even with what we have, we need to actually plan properly with it, right?
Hello, Doctor, I think come in here. I think come in here. Thank you again, say you join us this morning. When we talk about the health sector, some of us go and cry because we know, say, our health sector for inside Obodo, Nigeria deserves state of emergency, whether you like them or not. This morning I wake up and I see a particular story online of a woman where we say she gave birth to her children, 2 children, premature. But then the hospital, no one cater to her. No one treat her pikin because she never pay. Now, I believe in layman terms, say, hospitals they everywhere. But receiving treatment might be one of our major challenge for inside Obodo, Nigeria. I just want to know from your own opinion, how you feel, say, insurance will go a long way in helping Nigerians receive adequate care, not just having access to hospitals that are built everywhere, but ensuring, say, every Nigeria gets the right care where they need.
Yes, I think that that's a big question that we have been talking about for a long time now. Now, wait till we don't talk about since be that. And first of all, let me even backtrack on that a little bit.
Okay.
The truth is that hospitals there everywhere, but recently the Guild of Medical Directors talks say 50% of hospitals in Nigeria are shutting down, private hospitals, for example, and that the shutting down rate is still at 20% at the moment. And as at last 6 months, another 500 hospitals shut down. Now, so you have that is happening. You have our doctors leaving the country,
Yeah.
hospitals they shut. So even that access gone, don't they come out already, right?
Honestly.
Now, so basically, it is really sad situation that we're in. And so, what should insurance do? Our insurance should try to pull resources together and distribute them based on who need them at the moment or not, right? But the problem we have right now is that even the insurance coverage in Nigeria right now is about 9%, and that's due to a lot of factors, right? And what we can now do is the fact that we need to expand that insurance net. So we need to increase that pool of funds that we have in our insurance funds, right? And that is something I think the NIA Act is doing already, but I don't know if it's been fully implemented, right? But the problem with it is that who is actually taking the bill? Who is taking the initiative? And that's the question we need to ask, right? Because we know that we're a mixed economy. Now, we don't expect are we a socialist? Are we going to, so healthcare, is it a socialist thing for us or is it a capitalist thing? We need to answer these questions. These things are not just what we do vibes, right? So we need to say, who is taking up the initiative? Now, government has created policy. Do we have private individuals that are coming to say, okay, now that there's a policy that can favor insurance, are we going to pour in money and get people to increase the insurance net? Is that what we are doing? Are we waiting for government to do it? Because once you get that insurance pool funds to increase, all of these things will not happen. For that, the story that I heard this morning is something that I worked with for a long time when I was working in the rural area. I basically used to use my salaries as collateral for mothers so that they don't, exactly, so that they have their CS done and they don't die. Do you understand what I mean? I used to use my salaries then. So the point is that if we don't increase the amount of money in that pool, and so somebody needs to take that initiative. Are we waiting for the government? Are we waiting for private investors? Who is happy to take that bill and invest in increasing the insurance net? Because that's the only way we can really do it.
Thank you,
right? And stop stories like this, and even keep our doctors keep our doctors in the country and keep the hospitals alive. Without that pool of funds, it's difficult really to do anything.
All right.
Thank you, doctor.
Being person where we say you dey the line and you don't carry your eyes see how everything they happen for inside Nigerian health sector. If they say them put them for your hand as say make you work on how to put Kajad data-driven system for Nigeria, wetin be some of those things where you go suggest say make we do as a people and as as a nation?
Now, first of all, people need to. So I think that I wrote something on LinkedIn one day and I said, where's the empathy? I don't think that Nigerians are talking enough. And it never used to be like this before. I had this story in 1888 where Mona Diola died on admission because she couldn't access the Lagos Colonial Hospital. And Nigerians spoke out that this should not be happening. And this was 1888. The doctors are on strike today. Nobody's talking about it so much like that. So at the end of the day, right, if it was in my hands, which is what I'm trying to do at the moment, is basically to create critical infrastructure across the country. And what will I do? I'll basically revive the primary health centers, right? We have all of them in the local government in Nigeria. So I know that they are working on it already, right? But we need to be very proactive about creating it. If government cannot do it enough, private individuals need to come in and help government. Like I said, we are a mixed economy. Government cannot do everything, right? So we need PPP, we need the public-private partnership to actually revive our primary health centers. Now, those primary health centers, beyond just delivering basic care, which most of the time, most of the illnesses that we have in Nigeria are basically infectious diseases, maternity, which can be taken care at the level of primary and secondary. You don't need big hospitals to take care of those things. Even for the non-communicable diseases, diabetes, which you talked about in your program this morning, diabetes, hypertension can be taken care of. They are chronic diseases that you can get your medications every month, even at primary level, right? But the problem is that that primary level has failed. So we always want to go to those big hospitals, which we don't need, right? So basically, if it's my hands, number one is to revive those centers. Number two, like I said, those centers will be data collection points, right? So basically, I have hospitals all around the country that patients are going in there, I'm receiving data, then I'm able to plan across, I'm able to make public policies, I'm able to even plan insurance, right? Because another thing we know get is national guidelines for treatment. And this is what bothers me a lot, because, okay, even if I create access all over the country, the person in Borno, is he getting the same treatment for malaria as the person in Lagos? For example, and one thing I always say is also the fact that the treatment guideline is not just a medical note, it's also a financial note, because it helps you guide it gives you the most cost-effective way to manage a disease. We always forget that disease burdens equal to economic burdens as well, right? We always forget that bit. And so if I'm putting a national guideline out there saying that this is the most cost-effective way to manage malaria across the country, I'm managing the resources I have. And also what I'm doing is actually improving health outcomes. And so basically everything is just basically data driven. So what I would do is, number one, get the primary health centers working, make them data collection centers, and use those data to keep planning and improving the system as much as possible. That's what I'll probably do.
Okay, I have 2 questions in one, but I will try to compress them. Make I join them together, Sha. So question 1 now, I want to know, I see one sad video yesterday about one father losing baby and incomplete now because of 8,000 naira. Say he don't even spend a lot of money. So just that 8,000 naira, he say make you rush, go get him. Say continue the treatment. The nurse, he called the nurse name. Say she know help him Pekin die. So and this one don't bring about the fact say a lot of people go hospital, even some with gunshot injury, even despite the fact the government don't even talk, say treat them. First of all, treat them, save life first of all. But it can't be like say hospital no even bother they save life first if they no see money or they no see maybe police report or something. But why? Because I watch, if it's an film, but I watch film where they treat the man first of all before they call police for the man. They shoot the man, they treat the man first before they call police for the man. No, nothing. But so why you know suppose why you know they happen like that? Especially when some people they innocent where they just maybe stray bullets meet them. That's my first question. Why hospital no they sensitive enough or empathic enough to help save life first of all? Then secondly, a lot of doctors don't they run come out go obodo oyibo for greener pasture. So waiting you feel say government supposed to do to put in place to help, you know, make we get, because we read one story now where they talk say 4,193 doctors also don't run 2024 already. So I hear say government they try put some stiffer penalty for doctors say if you day here, if you read medicine, you go day here for 2 years before you go fit travel out and all that. So people say now fairness and all that. But what about we need to now the wrong go unko? What do you think say government supposed to do?
This is your question, Tyra.
Two elephants they fight, now grass they suffer now. Now we they suffer.
I agree. Dr. Tolu, you there?
This question, I have to be very careful to answer because I'm still a medical doctor.
Exactly.
You see the Nigeria.
Exactly. We straight bullet this morning.
Obviously, I can't stop people from going abroad to seek greener pastures if they want to, right, and a better life. But let me start with the first question: why hospitals probably won't attend to people? And I think that just decades and decades of lack of trust between both the hospitals and the patient themselves, right? And it actually goes both ways, where hospitals have actually tried to do that in the past and it basically backfired, right? And so it's just basically lack of trust in the system, which is something that is sad, but it's just something that we need to understand that critically, that it's actually basically lack of trust. And that if the hospital actually takes the bill to take care of this patient, then what happens really? Now, we are dealing with one of the worst financial times in the healthcare sector at the moment, right? So you can see by the doctors leaving, the hospital shutting down. And so if you're asking the hospital to keep taking the bill, then the question will be, then what happens to us if the patient refuses to pay? Now, that is, and so when you're in this situation where things are this sad, you need to look at it from a very macro level, where, okay, so what do we need to do to remove this this kind of very weird decision making between the hospital and the patient, right? And this is where, to be honest, I'm going to say the government is already doing what they can. And as I always say, government are policy makers. They should not be too involved in the business of doing things. Like, they should make the policy to enable the ecosystem to apply for it, which basically they are doing already. I just feel like we still need to we need to actually decide what we want to do with the way we want to finance healthcare in Nigeria, and we need to have a lot of conversation around it. And the question will be, if the government wants to go all out, for example, in the UK, where the government is going all out to fund the healthcare and saying that you guys have to pay from your salaries for national insurance, for your health insurance, that's fine. If we're going to rely on private individuals, then we should rely on private individuals and protect the vulnerable ones from capitalism of the healthcare system. So at the end of the day, the discussion will always be, which right now, what is really the answer? The answer will always be, we need to decide, what are we really doing? Do we want government to take all the bill, or do we want private individuals to come in, invest, and play the long game, right? And that is where we are with that situation. So it's basically decades and decades of lack of trust between the patient and the hospital, and hospital and patient. And it's difficult to say, oh, you take the bill, just do something. But for me, I always say that treat first, but don't do further harm. Treat and refer. Treat and refer. Always offer first aid and refer. Offer first aid and refer. At least do your best. Do you understand? Because at the end of the day, 8,000, 10,000, even if it's 1 million, it's never worth a human soul. So do what you can, doctor, and refer. That's what I always say. That's for me, that's the policy for me, like that, because of where I trained. I trained in rural areas, and I've seen people lose lives for ridiculous amount, as low as 2005. So it doesn't make any sense. For the doctors leaving, I think you can't force it, because people forget about doctors. People always leave if they think that there's a greener pasture somewhere. So migration is a thing. But two things that you need to consider is, number one, is it fun to work? Not fun, obviously. Maybe that's not the right word. Is it interesting to work as a medical doctor in Nigeria? And the stress levels, the lack of basic tools and all of that, the knowledge exposure, right? And then also, is it financially rewarding to actually work? And those are the questions you need to ask. And for me, they are very easy to fix. And for me, I feel like we can get our doctors back, and we have done it before. We have done it before in Nigeria, and people forget very easily.
Thank you so much, Doctor. Thank you, Dr. Tolulope. Thank you.
Yes,
the answers full for your mouth. You get all the answers to all the questions, but thank you. You don't share with us today. Very important. We need to do more. We need to ensure, say, the same quality of care where person they get for Lagos, now you go they get for Kano, for Jos, for Gombe, and all those other states. And you don't also talk, say, the healthcare system need more investment. We need to boost ourselves in such a way, say, everybody will get access to that healthcare and proper quality, healthcare services. Thank you so much, Dr. Tolu. Thank you, say you join us today. Follow us, gist, talk about this important matter where the warriors for this country. And here we go end them for this particular topic. When we come back, we go shook maths into the tori them as they hot, because we don't say our viewers they wait. We they come, no go anywhere.
Stay tuned. Your View will be right back.